The topic to be discussed is about respiratory stimulants. What is its definition, uses, examples, and how they work? So first, patients with chronic obstructive lung disease who develop acute respiratory failure are hypoxic, hypercapnic, and acidotic. In the treatment of these patients, it is necessary to raise the arterial blood oxygen tension to acceptable levels and to reduce or at least prevent a further rise in arterial blood carbon dioxide tension. These objectives may be achieved either by stimulating respiration with drugs or by assisting respiration through use of intermittent positive pressure machines. So what are respiratory stimulants? Respiratory stimulants are medications used to stimulate respiration post-anesthesia or to treat respiratory conditions such as chronic obstructive pulmonary disease, respiratory depression or failure, and neonatal apnea. Respiratory stimulants improve the respiratory drive and oxygen inflow as a result. They are also of resuscitative value in coma or fainting and is responsible in stimulating respiration in order to restore normal breathing. Respiratory stimulants are used for chronic obstructive pulmonary disease associated with hypercapnia, respiratory depression post-anesthesia, drug-induced central nervous system depression, fatigue and drowsiness, respiratory failure, and neonatal apnea. It is essential to understand the general principle that neither respiratory stimulant drugs nor assisted respiration ever cured anything. These methods of treatment buys the time necessary for other medical treatment to be effective. If the precipitating cause of the acute respiratory failure is not reversible, then the patient will die or at best may become respiratory dependent. Respiratory stimulants drive respiration by stimulating the brain's respiratory center in the medulla oblongata, located at the base of the brain. The medulla senses a rise in carbon dioxide and drop in oxygen levels in the blood and stimulates respiration. Examples of respiratory stimulant drugs are, first, Doxapram Hydrochloride or Doxapram. Doxapram stimulates both central chemoreceptors located in the medulla and peripheral chemoreceptors in the carotid body, a sensory organ in the carotid artery. Chemoreceptors are specialized cells that sense oxygen and carbon dioxide levels in arterial blood and stimulate respiration. Doxapram is administered intravenously and plays a role in stimulating an increase in tidal volume and respiratory rate. Second is caffeine. Caffeine creates feelings of alertness by increasing nervous system activity, which in turn speeds up the heart rate and rate of breathing. As the heartbeat and breathing rate quicken, more blood and oxygen are delivered to the body. Caffeine inhibits the activity of an enzyme known as phosphodiesterase, which leads to an increase in the intracellular levels of a signaling molecule known as cyclic adenosine monophosphate. An increase in medullary CAMP levels enhances its sensitivity to carbon dioxide. Caffeine also decreases risk of bronchopulmonary dysplasia and decreases duration of positive airway pressure support.